It's a big concern. A vaccine is only effective if people take it. And I understand that people have concerns. I've heard people sort of, ask certain things like, well, what about this? What about that? The important thing is look, there's a small core of people who are going to be opposed to vaccines no matter what we do, no matter what we say. But there's a larger segment of the population that is, as you said, vaccine hesitant. They're not opposed to vaccines, but they have questions, they have doubts. And I think we just need to address them. So when people say things like, oh, they're rushing development, they haven't tested this in animals first. And the answer is, well, no, they have. There have been tests on animals, absolutely. And then people will say, well, there haven't been enough safety trials. Like, well, there have. I mean, they're still doing the same degree of safety trials that they would do for any other vaccine. They're just shortening the time between the various phases because they're making sure funding is in place so that people don't waste time doing the bureaucratic stuff. So if we can address people's concerns one by one, I think we're going to go a long way to helping people understand, it's like, no, this is going to be safe. And of course, there is a benefit. Thousands of people have died from COVID-19. So even if you yourself think you're going to be okay, that you're young and healthy, maybe you don't need it, you should get vaccinated for the same reason that I get the flu vaccine every year. I do it not so much to protect myself, but to protect my patients, many of whom are sick, older, vulnerable patients who might die from this. So we have to think of it that way. And then again, address people's concerns one at a time and show them like, no, there's really nothing to fear here. And when we get a vaccine, show them like, look, it does work, it does help. And this is something that we all have to do just to protect society.
Is there an established figure, Dr. Labos? I mean, what threshold do we have to get? What percentage of the population do we have to have vaccinated for it to be effective?
So it varies disease to disease. It depends how infectious the disease is. For something like measles, it's over 90%. For other diseases, it's in the 80%. So it's certainly above 70%. Where it is exactly, we don't really know. As we get more data on this virus, we'll find out. But it has to be the vast majority of the population for us to develop a herd immunity.